Scientifically speaking, we're sharing the view. From labs to clinics, breakthrough shining through, with minds that inspire and stories to unfold. Scientifically speaking, the future's being told.
Welcome to Scientifically Speaking with Christine on Oz Arab Media. Today, my guest is a highly respected dentist and community leader, Dr. Abraham Constantin. With a career spanning over almost 4 decades, he is the CEO of the Global Facial Aesthetics Training Network and a private practice dental surgeon. He has dedicated his career to advancing dental health, facial aesthetics, and professional training for practitioners both in Australia and internationally. Graduating from the University of Sydney, Dr. Constantin is a member of the Australian Dental Association. He is also a fellow of the International Academy for Dental Facial Aesthetics in New York since 2014, and a fellow of the Pierre Fauchard Academy in London since 2019. Dr. Constantin is committed to enhancing oral care both in function and aesthetics. As a lecturer and head trainer, he continues to shape the next generation of dental and facial aesthetics professionals. Today, he joins us on Scientifically Speaking to share his expertise on oral health, facial aesthetics, and the evolving role of dentistry in overall well-being. Dr. Constantin, welcome to the show.
Hello, Christina. Thank you for having me.
Of course. Thank you so much for joining us today. Dr. Constantin, you've had a remarkable career in industry, just like we just spoke, and the facial aesthetics as well. What inspired you to enter the field of dentistry?
Well, becoming a dentist was a childhood dream.
Right.
I recall when my dad used to work as a security officer at the medical school at the university, American University in Beirut.
Yeah.
And on weekends, I was about 7 years of age, he used to bring doctors to Mardouchi, where we lived, for coffee, to spend the weekend, to spend a few days there. And I got the idea from there. It just grew with me.
Oh, nice.
And, it was a childhood dream, and we achieved it.
That is amazing. You've been in private practice since 1987, and you have trained dentists in facial aesthetics worldwide. How has the field of dentistry evolved over the years in your experience?
Well, look, whether it's dentistry or anything in medicine, things do improve on a daily basis.
Right.
If you want to start looking at how dentistry has improved, it improved in so many arenas. One, in terms of equipment, chairs, drills. They used to be so slow moving in the olden days.
Yeah.
Now they're so fast, causing less pain. You've got dental materials. When I graduated, amalgam was the material of choice. Now we hardly use amalgam because of the mercury content in amalgam, and also the way it looks. It looks, like a metal.
That's true.
Now we use composite resin and other materials. Even with composite resin, they're improving the products, on a daily, weekly, and yearly basis.
Amazing.
We used to do crown and bridge work. Now we've got the option of implants. We used to do, and we still do, orthodontics. Now you've got also Invisalign. So things are improving on a continuous basis.
True.
And all for the benefit of the patient.
That is great, but many people underestimate the importance of oral health, Doctor. How does dental health really impact our overall well-being?
Look, people used to think, okay, it's in the mouth, nothing else happens.
Right.
If you've got a dirty mouth, it stays in the mouth.
Right.
It's wrong, because having plaque and bacteria and these products in the mouth can travel through your arteries, and go into your heart, cause heart issues, especially when you've got valvular problems. You can develop inflammation of the lining of the heart. It can go through your bloodstream. It can cause inflammations elsewhere. So bacteria in the mouth directly affects a person's health, not just the oral health, it's the general health of the person.
Well, that's interesting to hear. Tooth decay, doctor, is the most common dental issue that people are aware of worldwide. What are the best ways to prevent it, and what are there any misconception about the cavities?
Well, look, it's not just tooth decay. There are two common causes of tooth problems, and that is tooth decay and a condition we call, it's an inflammation of the gum, which we call gingivitis.
Yes.
If, you know...
Is that the gum disease?
Gum disease,
Yeah.
gum disease. If you ignore gingivitis, it can develop into something more severe, which we call periodontitis. Periodontitis, that means bacteria and infections start attacking the bone that's holding your teeth. And when you reach the stage of periodontitis, your teeth will become mobile and you lose them. The same way with decay. Decay will basically rot your tooth, and if you're not careful, it hits the gum, it hits the pulp, the nerve. And once it hits the nerve, you've got then two options. Either take the nerve out and disinfect the whole area again, because as you know, bone is sterile.
It is.
And the only way bacteria can go into bone is either through the pulp, which is the nerve area, or the canals where the nerve lies. If you've got a direct opening between mouth and bone, through that canal, then you'll get bacteria into bone, you'll start getting infections. Then you've got two options: either do a root canal therapy where you take the nerve out and disinfect the whole area again and sterilize it, or lose the tooth. So both cavities and caries and periodontal disease and gingivitis, which is gum disease, both cause tooth loss.
Wow, that is more serious than I thought it would be. But another frustrating issue is dry mouth syndrome. What causes it, and how can it be treated?
Look, various conditions can cause a dry mouth.
Right.
I mean, you've got dehydration can cause dry mouth. People who have conditions, medical conditions like diabetes, that can cause dry mouth. And the way you treat it is basically by either introducing more fluids into your mouth, introducing fake saliva, which will act as the normal saliva. As you know, there are two areas in the mouth where saliva comes into the mouth.
Right.
And that's directly under the tongue, in the front of the mouth, and against your cheek, internally.
On the side.
On the side of the cheek, in the area of about your first molar.
Right.
So you've got two areas where saliva comes into the mouth from.
Right.
And so you can treat it with various medications, and you know, things go back to normality. People, asthmatics, for example, because they breathe through the mouth, that causes dryness. So you can train the asthmatic to start breathing, you know, through the nose. And so basically changing habits can assist.
So natural ways can really assist rather than medications?
You can use natural ways, and if you can't, then you can use things like artificial saliva to facilitate matters in the mouth.
Amazing. What about oral thrush, doctor? It is another condition that people might not know much about. What are the common symptoms for it, and how can we seek treatment?
Yeah. Just if I may add on the previous questions, certain medications that people take, blood pressure medication, diabetic medications, they can cause dryness of the mouth. So you can speak to your doctor and he can change the medication to assist. Now back to oral thrush. As you know, thrush is not just oral. It can also happen in the genital area.
That's right.
You know, from all sorts of factors. But let's talk about oral thrush. It's a name that we a medical term that we use called oral candidiasis.
That's true. I tried to just be very simple with my
and oral candidiasis is a yeast called Candida albicans. You get an overgrowth of that yeast in the mouth, and it causes a white mass on the back of the tongue, on the front of the tongue, on the back of the cheeks, on the inside of the cheeks, and it can spread to the esophagus at times. And It can be caused by many factors.
Right.
Certain people who take antibiotics, amoxil, a lot of people who take amoxil can cause thrush.
Wow.
People who are have immunity issues, taking corticosteroids, it can cause thrush. The way you do it is basically change medications, treat it with nystatin, with creams or with tablets or with liquid medicine that you can drink and keep the area clean.
Right.
But yes, it's not a simple.
It's not a simple case.
It can be also contagious. People who are immunity suppressed or immune suppressed can catch it. It's good to be careful.
To be careful, of course. The very next topic I'd like to talk about, Doctor, is the TMJ, and I simplified it because it's a big word. It's a disorder, and it affects many people on daily basis. If you can just give us a brief, what is TMJ and how can we really treat it?
Sure. Yeah. It seems every time you ask me a question, I remember two important factors from the previous question.
It's okay.
If I can also add smoking and alcohol are big contributors to thrush.
Of course.
So lifestyle habits can also change.
Yes.
Now with TMJ, which is temporomandibular joint dysfunction.
Yes, that's a big word.
For us, it's easy terms because we start breaking down the word. Temporo belongs to the temporal bone, which is the side bone.
Okay.
Mandibular, it's your mandible, which is the jawbone.
Okay.
So temporomandibular joint. So it's a joint where it's linked to the temporal bone and to the mandible.
Amazing. Is it the jaw part? Can we say is the jaw part of it as well?
No, it's a ball and socket system.
Okay.
So you've got the jaw part where one of the ends of the jaw, we call it the mandible.
Right.
On the ramus of that mandible, which is the upper side of the mandible, there's a ball-like structure.
Right.
And then you've got your temporal bone with a fossa, which a concavity, and then the ball from the mandible lies in that fossa.
Okay.
So that ball and socket system allows us to open and close the mouth.
True.
And it also allows the jaw to go forward and go backwards.
Yes.
By attachments of certain muscles.
Right.
Like the major opening muscles are masseter muscles.
Yeah.
And you've got various muscles that can move the jaw in different directions.
Okay.
Now, with TMD issues, which is a temporomandibular joint dysfunction, which can be caused by bruxism, which is bruxing your teeth at night.
Yeah.
It can be caused by an accident. You get hit on the jaw area. It can be congenital. You can have a defect in that area.
Yes.
You can also have various ways of eating and grinding your teeth that can also cause those problems. The way you treat it is by sometimes changing your lifestyle habits.
Okay.
You know, if you try to buy hard things, try to get softer food for the time being.
Okay.
Also, try to massage your masseter muscles.
Right.
So as you open and close the jaw, just do some massages. We also treat patients with what we call a maxillary splint.
Okay.
It's like a mouth guard, but it's a hard mouth guard that you wear at night when you sleep for a minimum of 3 to 4 hours. So basically when you sleep and when you wake up, you can take it off. That can assist with the problem. And now I find I'm doing a lot in the surgery when everything else fails, is injecting Botox in masseter.
Wow, I was going to ask that one. Is there any surgical treatment or procedures for it?
It's not a surgical treatment, it's an injectable treatment where we inject botulinum toxin, not just necessarily Botox, but botulinum toxin. It could be Botox, it could be Xeomin, it could be Dysport.
Wow.
So we inject 20 units in each masseter, and that usually relaxes the muscle. And eases off the headaches and the tension in the muscle.
Amazing. Wow, that's a new study. In regards to the pain that comes along the TMJ, is there any advice you can give the patients to relieve a little bit of that pain?
Look, pain comes in mostly in the you get a tiny bit of inflammation, tenderness
Right.
of the joint area, but most of the pain comes in the form of a headache.
Yeah.
And the way you treat a normal headache with
paracetamol.
paracetamol,
Right.
aspirins, you can use that. But eventually, it's a band-aid treatment. You need to treat the cause.
the cause.
And if the cause is clenching, you need to treat the clenching by either supplying an oral maxillary splint
Right.
or treating with botulinum toxin.
Amazing. Facial aesthetics, doctor, and dentistry has come along together closely recently. How has this field of facial aesthetics enhanced, if I can say, or transformed dentistry?
Yeah. Well, look, in the olden days, when I graduated back in 1986,
Right.
everything was focused in one direction. A dentist is supposed to work in the mouth.
Right.
So open your mouth, whatever's in the mouth, that's the role of the dentist.
Right.
Well, now the role of the dentist has expanded further because we know that all your facial structures, all your muscles of the face are connected and directly affected by the mouth.
True.
Whether, by the jaw, whether it is by the corner of the mouth. When you smile, you've got muscles connecting the mouth, to various bones in the
Yes.
face. So everything is interrelated.
Right.
And hence, I think it was about 2014,
Right.
the dental board met, APRA met, and they decided that, we should allow dentists, to do certain treatments on the face if they are part of the dental treatment,
Of course.
related to the dental treatment. And so you've got two aspects now where you've got dental cosmetics,
Right.
where you fix teeth, you do crowns, you do facings, you do veneering, and you complement it by fixing, nice lips, by lifting up cheeks, removing certain,
I love it.
So, and being a dentist, you study all sorts of anatomy.
True.
I think we as dentists study as much anatomy as a neurosurgeon of the face, of the head and neck.
True.
So we are quite capable of understanding what is in the vicinity. We are very cautious because, the way we deal with the mouth internally, and we take the same precautions and care of the patient in the same way. So dentists are best placed to do some facial aesthetics.
That is true. I agree.
And
But-
the last thing you want is to do a $20,000 treatment on a patient
Yes.
where, they've got a beautiful smile, but they want to improve their lips to complement that smile.
That's why not?
Or you've got wrinkles everywhere around that smile. So you
Yeah.
come to the dentist, we fix your teeth, we make you look good, and we make sure your face complements your teeth.
Cherry on top. Why not? But what are some of the common concerns people have when it comes to their facial aesthetics, doctor? And how do modern dental treatments really help that?
Look, common concerns are tooth loss. If you lose a tooth,
Right.
what do you do? Okay, we've got all sorts of treatments to replace a lost tooth. You can, have crown and bridge to do a fixed bridge. You can have an implant. So there's all sorts of options now people can use. If you've got many teeth lost in the mouth, you can do a partial denture. There's also different types of partial dentures. You've got flexible ones, you've got chrome cobalt, you've got acrylic. So it all depends on what suits best the patient. To me, it's no longer a concern because every concern has a solution. Now.
That is true. That's great. If you don't mind me, Doctor, tackling a little bit some topics related to children's dental. We've got a lot of parents listening to us and they worry a lot about their children's dental health. Just briefly, if you can tell us how are baby teeth developing and when should the child start seeing a dentist?
Look, how teeth develop? Usually teeth start developing about the 6th or 7th week of pregnancy.
Oh, wow.
So they start developing early. So teeth start coming into the mouth from the age of about 6 months after the child is born. And it takes about 2 years to get the full baby dentition. We call it deciduous dentition. And then you start getting some permanent teeth in the meantime, replacing baby teeth. And the whole process goes to probably about the age of 12.
Right.
So you're changing teeth. The main concern is to make sure when the baby has their full deciduous dentition,
Right.
is like we do as adults, we need to keep it clean.
Yes.
How do you train a child? Okay, take a brush in your hand in the shower, start showing them what you do.
Yeah.
Let them play with the toothbrush. They might start eating it in the first few weeks.
Yes.
Then you start putting special toothpaste for them.
Sorry, doctor, as young as how old would that?
For as long as they can carry a brush
Oh.
and they've got teeth in their mouth,
Oh.
and you're able to show them how and they're happy to play with it and start
Sure.
learning, there's no limitation.
Nice.
And so teach them how to start brushing. As they grow a bit older, start explaining to them why they need to keep their mouth clean.
Yes.
And the main aim is to make sure that all those baby teeth do not decay before the permanent ones start coming out.
Okay.
The last thing you want is for a baby tooth to be lost early,
Yes.
because it will affect the tooth underneath it that's coming out.
Okay.
It can push it out of position. So we need to maintain the spaces for those permanent teeth.
Right.
And the scary thing with parents, and they always call me to say, look, our child, their permanent teeth are coming behind the ones that are in the mouth. That's nothing to worry about.
Okay.
All anterior permanent teeth, especially the lower ones, come from behind the baby tooth.
Oh, okay.
As it progresses in eruption, it starts pushing upwards and forward. As it pushes forward, it starts dissolving the root of the baby tooth. And that's how the baby tooth falls off on its own.
Okay.
Only when it reaches a time where 6 months have passed, when that baby tooth should have come off,
Right.
or a year has passed, then the dentist can remove that tooth physically. But leave things to nature. Do not worry. Let nature take its course, and when things need to happen, they will happen.
Right.
Your concern is to make sure the child keeps their teeth clean. And that's it. Oral hygiene from young.
Right. And when should the kids start seeing a dentist, really?
Look, I'd say age of 1.5 to
Oh, wow, that
bring
young.
them with you.
Yeah.
We sit them in the patient's in the mother's lab.
Right.
They see their mother opening their mouth. We ask them to open up and how beautiful
So
their
that they
teeth
don't get the
look.
horror of-
We don't need to do anything in the first
Yeah.
appointment.
Okay.
If a child sits there, opens their mouth, and they're happy, and you tap them, how beautiful their teeth
Aw.
look, and that's all you do in the first appointment.
Right.
That's enough to convince that child that coming to the dentist is not a scary thing.
Amazing, because some people, adults, still are scared to come to
Well,
the dentist.
we're all born, outside Australia and Lebanon and other countries
They scare us.
where the dentist had absolutely no social skills.
Yeah.
They used to slap us on the face.
Oh,
and
I know.
I recall at one, I think I would have been probably 5 or 6.
Yeah.
I recall the dentist putting his knee on my stomach to keep me down.
Oh, wow.
To do something in my mouth. So
Yeah.
all that grows with you
Yeah.
and develops this psychological problem
True.
of the dentist being a bad person.
That's true. If we need to wrap up the children's dental care, what are some myths about children's dental health you'd like to debunk today?
Look, you hear a lot of people saying, oh, they shouldn't be eating sweets and they shouldn't be eating chocolates. And I'm a person, personally, I'm a believer in let the child eat anything he wants or she
Okay.
wants. As an adult, you can eat whatever you want.
Right.
As long as you clean your teeth and you maintain your oral hygiene, it should have minimal effect on your teeth.
Wow.
On
So cleanliness.
Cleanliness is the main thing, morning and night. You should at least brush them in the morning and definitely before you go to bed. And as an adult, keep a floss in your pocket.
Right.
Take a brush to work. You have lunch, brush your teeth and floss them.
Wow.
So it takes a few seconds of your time every day.
True.
And there's no excuse.
No.
and the stuff that we see in our practice and every dentist
I can imagine.
practice, you wonder, do these people know what a brush looks like?
Oof.
And they say, oh, gee, our tooth hurts, or, look, the gum is bleeding. Of course it's bleeding. you're lucky to have your teeth left in your mouth.
Wow.
So oral hygiene, we can't stress enough.
Yes, of course. I agree as well. Doctor, we are coming towards the end of our conversation that went really fast, and I really want to ask a lot more. But if I want to focus about your leadership, so you've trained dentists globally through the Global Facial Aesthetics Training Network. Can you share with us what are some of the biggest advancements in the industry nowadays?
Well, look, when you talk about facial aesthetics,
Right.
there are millions and millions of injections happening every day worldwide.
Yes.
When it comes to people having, botulinum toxin in their faces, doing their lips, lifting their cheeks, removing wrinkles from the face. So there are, it's an industry, billions of dollars worth worldwide. I personally don't look at the money.
Right.
I look at the improvements.
Yes.
If I can make an improvement that can improve the person's psyche, psychologically, a person feels better about themselves,
Yes.
that's what makes me happy. How much the treatment costs, that comes later.
Right.
But you shouldn't put cost before treatment. And you shouldn't also do treatments that are unnecessary for the
Right.
patient. You shouldn't overdo any treatments.
Yes.
What we teach in our course, and that's a course that's done for medical practitioners,
Right.
dental practitioners, is that the main thing is to achieve a natural look.
Yes.
The frozen look that you used to see in the olden days, no one wants a frozen look anymore.
Yes.
Because once you have a frozen look, everyone knows that you've done something to your face.
Yes.
If somebody looks at a person and they say, look how big her lips are,
Yeah.
the person who did those lips have failed in their treatment
True.
because you're supposed to improve things with people not noticing
Yes.
the changes. So once you achieve that natural look without people realizing
Yes.
that you've done something, that's a great success.
That is
And
true.
unless the patient is willing to listen to your advice
Yes.
and see what is needed, if they've got expectations that cannot be met, they're the patients you get rid of.
You got it.
If they're willing to listen to you and do minimal treatment that can improve the way they look, that can improve their psyche, and without any major
Dramatic
changes
looks, yes.
to their faces, they're the people you would love to treat.
Definitely. Well, Dr. Constantin, thank you so much for joining us today. Where can our listeners learn more about your work or your clinic or the training programs that you do?
Well, look, I've been in the Lakemba area for over 40 years. I don't think there's anybody that doesn't know where Dr. Constantin is.
Amazing.
In terms of training, unfortunately, it's not available to the public.
Yes.
It's only for medical and dental professionals.
Right.
And so it's restricted to professionals.
Yes.
And anybody that wishes to ring and call for advice, we always, answer their concerns and whether they're our patients or not, we give them the advice and they can go to their dentist and ask for whatever they need.
Amazing. Thank you so much, Dr. Constantin. We really appreciate you in being with us today in Scientifically Speaking. We hope to have you back. Since the trainings are not for public, maybe we can have some advice or two on Oz Arab Media. Thank you.
Thank you, Christine, and I'd like to thank Oz Arab Media
Thank you.
for the work that you do with our community.
Thank you so much,
Thank you.
Doctor. To our listeners, whether you're a parent, a patient, or simply someone who wants to smile with confidence, remember, your dental health is the foundation of your physical and emotional health. Thank you for tuning in to Scientifically Speaking with Christine. Stay informed and stay curious.